I wanted to introduce a wonderful practitioner in my neighborhood, the founder of Inspira Physical Therapy. She is a physical therapist and a Pilates instructor. So hello, Dr. Carminati.
I am a licensed physical therapist in the state of New York. I have a Doctor of Physical Therapy degree, and I hold multiple certifications from different Pilates organizations and also different physical therapy organizations. So I am fully certified through Polestar Pilates, although I also have some Power Pilates classical certifications as well. And then I am certified through a national organization called the Pilates Method Alliance. In addition, I have advanced training in craniosacral therapy, visceral manipulation, pelvic floor physical therapy, and then different advanced orthopedic techniques such as through NIOMT and IPA.
Such a well-rounded practitioner. I know that you work with a range of conditions, and what would you say your specialty is, and how long would you say that you've been involved in that particular specialty?
What's actually evolved for me in my practice is that I end up seeing people who have complex cases, that it's multi-layered, multi-system. I've been working as a physical therapist for about 7 years. It's evolved into the more complex cases, I would say, only recently in the past 3 or 4 years, wanting to learn more myself from some of the patients that I was treating, and then going to get the advanced training to solve these problems that patients were coming in with, that it's evolved into this. So case-wise though, I treat a wide range of cases. So it can be an advanced orthopedic condition, it can be pelvic floor, women's health, men's health, or it could be visceral. It could just be, some kind of pain, some persistent pain state that someone is in.
Regarding the driving factor that got you into your specialty, was it kind of just a matter of the clientele that you were seeing, like your patients that were coming in, and that's kind of just their range of concerns, or was it something different?
My background is in dance. So when I was in undergraduate training and performing in different organizations in Philadelphia, I was exposed to a whole range of different movement methodologies, Laban movement, Alexander technique, all of that stuff. And just being in that kind of holistic environment definitely influenced me. Being a dancer, I appreciate the body and understand the body in a way and in terms of movement that maybe some others don't, because they haven't had all that movement experience. But then because of that dance background, I ended up working at Polestar Physical Therapy and Pilates Center in Miami for my graduate internship. They were really the stepping stone for me in the direction of how I wanted to practice, because they were a center that had Pilates rehabilitation, myofascial release, pelvic floor physical therapy, all in one place.
Your knowledge is so vast, and I feel like you know so many different kinds of modalities. So the way that you practice and with your specialty, how would you say that the way that you might practice is different than maybe the mainstream practitioners in your field?
What happens when patients come in for evaluations is I evaluate them on a whole body, a whole person level. Some of the evaluation techniques that I do, they may be more holistic, more osteopathic, such as different abdominal visceral manipulation assessment, or even just standing craniosacral assessment. I listen to my patients. One of the big things that I do in the evaluation is just listen, because many times 80% of the information that you need to know comes from the patient themselves. And listening to the patients, listening to their story guides me into what I do. And I don't do the same thing with every person. It's whatever they tell me and what their body tells me they need.
Now you kind of deal with more complex situations and you really like to problem solve. And before getting to where you are now, were there other forms of pain management that you worked with before doing what you do today?
I worked with practitioners who would specialize in one form of pain management. So it would be myofascial release or Pilates rehabilitation, or it might be a women's health specialist. Just from my training, I hadn't yet encountered someone who put it all together. It's evolved for me, but previously just working with different practitioners, it was more, okay, this is myofascial release. This is pelvic floor physical therapy. this is Pilates rehab. And now it's become just a combination because I have all the different training, just putting it into my own thing.
So now the approach that you take, I feel like it sounds like it's especially effective because of communication, for one. You're listening to your patients who are coming in, trying to tailor sessions to them, using a range of modalities that you know. Is that accurate to say?
Each session is unique for each person, and I do rely a lot on patients telling me how they feel and how they feel after the sessions, because each day can be different. So people who have persistent pain, they'll know that one day they may feel one way, another day they may feel another way. Just really meeting the person with where they are in that moment guides how I treat them.
How often do you feel like patients come in and they're truly surprised with the way that you treat them? Maybe they've gone to other physical therapy practices and they kind of feel like they're rushed through. People are working with a lot of different people, and then they come and see you. I feel like you have a different approach than what many people might be used to. So how do you kind of explain your approach to patients, and then also what expectations do you set up with them regarding moving forward with their treatments?
I inform my patients that I treat in a more comprehensive, advanced, holistic method. And some of the things that I do with them, they may have never experienced. That is really common when I implement any kind of craniosacral or visceral or even some of the pelvic floor internal work. Patients are often surprised when they experience visceral manipulation or craniosacral therapy. And then when it comes to the pelvic floor treatment, if there's ever internal, we discuss it thoroughly beforehand. On the initial evaluation, I always explain to patients that physical therapy is progressive. So we start with a foundation and then we build. So everyone's length or course of treatment is different because it depends how long someone has had a certain condition, how long they may have been experiencing pain. And very big on communication. Like I literally say, communication is key in the evaluation because I need to know how the person's feeling. And based on how they respond to the treatment will dictate how long it may take for them to be discharged from physical therapy.
I know that you do a lot of internal PT work, which is fascinating to me. And a lot of people have never even heard of that, something that's really essential for a lot of women. What conditions do you feel respond really well to what you do, including internal physical therapy work? And then is there anything that's particularly difficult to treat? And why would you say it's so difficult?
Based on how I treat, I would say that any condition that involves pain. It could be shoulder pain, it could be hip pain, it could be pelvic pain, it could be back pain. Because I'm treating comprehensively and I'm addressing a whole bunch of things, it tends to check off all of the boxes and it just allows for the full recovery. Because when you're treating a person, you know, it's multiple layers of tissue. It's muscle, fascia, visceral organs, skeletal, you know, so it's many things that I'm addressing. In terms of the internal work specific to pelvic floor, patients that benefit a lot from the internal pelvic floor work tend to be the pelvic pain patients, because many times in pelvic pain, the pelvic floor musculature and the pelvic wall are hypertonic, meaning that they're very tight. This can be a result of trauma or just training. I actually see it a good amount of dancers who are trained to, you know, lift up and, you know, have everything controlled in the pelvic floor and the abdomen at all times, often have a hard time letting go of that muscle tension in the pelvic floor and the abdomen. And then it also just depends on some other movement factors, like how does that person move? Do they always tend to have their abdomen tight? Do they have an anterior tilt in their pelvis? Posture has a big influence in it also. But in terms of internal pelvic floor work, pelvic pain, so anyone who's been experiencing pelvic pain, dyspareunia, it could be, you know, painful intercourse, responds well to internal work. Also postnatal women, so women who have given birth and may have experienced a perineal tear, they many times end up with scar tissue. Scar tissue along that area just needs really simple mobilizations to relieve any fascial restrictions that might impede return to sexual activity or even just normal bowel bladder. From a patient perspective, many times patients want a quick fix, and everyone's body is different, everyone's story is different. So recognizing that is really important. And the journey of rehabilitation, it varies. Being able to treat a condition quickly isn't necessarily the best for someone. So the length and the course of treatment varies.
Now, with your internal PT work, is it usually manual or are there other devices that you might use based on the individual? Do you use like any kind of computer system that also can read muscular strength?
Typically, for me, just in my practice, I do hands-on manual internal work for any vaginal internal work. But if we're dealing with colorectal or like constipation or some kind of defecation dysfunction, then I am more likely to use biofeedback. So that's just when you're using a sensor and then there's a little computerized device that allows you to see when you're doing the contraction, and it's also cueing you when to relax, when to contract. It's very similar to the LV, which is why I don't tend to use the vaginal stimulators or biofeedback as much, because the LV is so popular, and many times I will just recommend that patients get that if they do need to do strengthening of their pelvic floor, which isn't always the case. Not everyone is supposed to be strengthening and contracting the pelvic floor. Sometimes people are supposed to be relaxing and then the reverse of a contraction actually bearing down. But I do use biofeedback primarily for patients who experience constipation, and they come in for treatment for that.
And with your other physical therapy client patients who come in, do you also use like TENS unit? Do you use heat? Do you use hot packs? Do you use any other kinds of modalities?
I have used heat and TENS in the past, but I have gotten away from it. I tend to go right to soft tissue work if I need the area to be warm. So I'll just do some soft tissue mobilization, a little massage, whatever it needs. But I do recommend heat and Epsom salt baths and stuff for home care. When patients come in for treatment because they're with me for 1 full hour, I want to do any hands-on technique that can't be done at home, and then any movement re-education that needs to be done with me there. I try to maximize the time for things that can't be done at home. That being said, some people do benefit from heat before they start exercising and doing certain exercises, so I'm not against heat in any way.
When working with pain and certain conditions, when muscles are weak or we fall into certain habits, it's hard to rehab doing like small fine-tuned movements. A lot of people think it's such a waste of time, but it's necessary and important to be able to move forward properly and correctly to allow our bodies to properly move, I think. So I love the work that you do. Do you use other approaches for pain management?
I definitely refer out to acupuncturists like yourself, or massage. I also refer, because many times orthopedists will refer directly to me. I may have to refer a patient back to an orthopedist if I think there's an MRI that's necessary. Because I deal with pelvic pain, I also work closely with gastroenterologists and pelvic pain physicians. Then another physician category would be physiatrists. They specialize in physical medicine and they are more focused on conservative kind of treatments and avoiding surgery. I often refer to physiatrists as well, and vice versa, they refer to me.
Typically, where do your patients come from? Are they usually referrals? Are you in network with any insurance companies? Is it their doctors, word of mouth? Where would you say the largest percentage of your patients come from?
I would say it's pretty divvied up equally between physician referrals, patient referrals. So patients who have good experiences will refer their wife or their daughter or their cousin or anybody who needs, one-on-one compassionate care. And then, acupuncturists as well as different movement practitioners. So Pilates instructors as well definitely refer to me because I have the Pilates background. And since I'm just in the Pilates community, people know how I treat and they know if someone would be appropriate to see me. I am not in network with any insurance, so it is all out of pocket.
Yeah, I know you have a big referral base. Everyone thinks you're amazing and they're so happy with the treatments that they get from you. I was wondering, how are your treatments usually compensated? Are they out of pocket typically?
So they are out of pocket. What I do for patients though, if they have out of network benefits, is my admin assistant actually sends out a super bill that has the CPT codes, the ICD-10 codes that they need for reimbursement. So if they have out-of-network benefits, they're able to get reimbursed for the services.
Well, thank you so much for taking time to talk to me and answer some of these questions. It was inspiring listening to you.
Thank you, Christina.
All right, have a great day.